It's defined in terms of 3 levels of achievement. You can think of them as 3 levels of maturity. And so it's meant to guide and recognize providers around the world in terms of what they've achieved in implementing value-based healthcare. Accreditation to providers is first and foremost the sign that they've actually achieved a important goalpost in their journey. What does it mean when you have be accredited in a given pathology, for example? It means that you are actually measuring along the full patient journey. You are actually able to understand how the patient is doing, understand how you're actually delivering patient outcomes, and your interventions are based on this data. Your clinical quality improvements is based on this data. Everyone speaks the same language, and everyone is aligned around the pathways that of patient journeys. The HM accreditation, I think, was really important to understand here is that governments and payers have a big stake in it. Why? Because typically they look to mainstream performance transparency, outcomes transparency in the health systems. And that's not easy to do. And so HM provides a faster, more commonly known standard around the world to actually do it. And to make sure they understand and they're able to compare outcomes across different providers. And of course, by the mere fact of measuring outcomes leads to improvements in pathways, so they become evidence-based in order to deliver the most optimal outcomes. And on the other hand, this also reduces complications, which means reduces cost, reduces complications, reduces unnecessary interventions that turn out not to have any impact on outcomes. So payers and governments have a big stake, and we're seeing that around the world. We're seeing endorsement not just from providers who want to be accredited, but also some authorities and some payers who are actually endorsing the HM accreditation and even sponsoring some providers to do it. I see accreditation in the next 5 years in keeping with the global movement to value-based healthcare, becoming a must-have, becoming the norm, in other words, right? Because essentially it provides the most secure, the most consistent and commonly known way to ensure that providers are measuring outcomes, are comparing outcomes, and of course they have to do it across a number of conditions, not just one condition. So in the next 5 years, I really see entire health systems adopting this in many countries around the world. And this is going to really move the needle on value-based healthcare.